Welcome, welcome, welcome. Happy Friday. It's great to see some familiar faces and names. Sarah and Crystal, hello. Thanks for being on camera. Folks are welcome to participate as you're able, of course, throughout the session. We've got a really fantastic hour and a half lined up for us today. So looking forward to sharing the space and jumping right in the morning. So this is our fifth and final roundtable discussion around the Data Science for Social Impact initiative. But as you'll hear about in just a little bit, this is not the last time we'll all be coming together. So today's event is focused on community-centered data practice. We've got some incredible special guests who you'll get to meet in just a little bit of time. And we are just so thrilled and grateful for folks' participation, taking the time out of your busy schedules to be with us today. This initiative is hosted and sponsored by WashU and the Social Policy Institute in partnership with Mastercard Center for Inclusive Growth, of course, the St. Louis Regional Data Alliance, and data.org. Before we jump in, just to make sure that everyone's brains are working, could you please post in the chat, get to know each other, let us know you're here, use as many exclamation points or emojis as you feel are appropriate, share your name, your organization or affiliation, and a pretty broad prompt for the morning. One thing that you're looking forward to in the next week. I don't know what's happening in the next week. I haven't really looked at my calendar, my social schedule, but so I'm looking for ideas. What's something that you're looking forward to in the next week that we could be keeping an eye out for? Of course, you can say this event and this session and the discussions as a default if you're coming up blank. So we've got a couple of folks here. Welcome, Anna. Sarah, hello. Traveling to Indiana. Have a wonderful time and trip. Courtney, hi. Crystal, giblet gravy over rice. That sounds incredible. Feel free to post links or share those as well. Ted, that was my thinking as well. I can't believe that it is late. It's late Thanksgiving. It's late November already. It's pretty crazy. Oh my goodness. Oh my goodness. Overeating, but with the slanted smiley face. Yeah, mixed emotions about how I'm going to feel coming out of that, to be sure. Dennis, hello. Wonderful to see you. Welcome. Talise, of course. It's a fantastic secret to be sharing about what will be happening next Thursday. Great. Shirley, hello. Lots of cooking. Fantastic. Okay. Well, it looks like an incredible group of people are here representing a wide range of organizations and things that'll be happening in the next week. If you're still thinking about that one thing you're trying to share, we'll be here for a little bit of time. So if you think about it, feel free to continue introducing yourselves. Okay, so the Data Science for Social Impact initiative. We're here engaging with the St. Louis community and the social sector, thinking about some pretty important topics. We can be as existential or as specific as we'd like to be in thinking about these things. But what we're really interested and committed to doing is developing a set of trainings and resources specifically for the St. Louis social sector, and helping to support organizations and individuals at a wide range of areas and a wide range of experience in the issue to more effectively increase impact and promote equitable outcomes. So our initiative began and begins in the development phase, having identified a gap that most training that's currently available around data science for social impact tends to be technically focused and geared toward aspiring data scientists and not reflective of the unique needs and opportunities for the social sector. So thanks for spending the time with us again today. And then the kind of trajectory of where we come from. This is the fifth of a series of roundtables. So we started back in the spring with two. How can a data-informed social sector amplify impact in St. Louis? From there, we formed an advisory committee that represents the St. Louis social sector, as well as national experts and leaders in data science and social impact. This series of 3 roundtables have been just a privilege and a pleasure to be a part of. I'd like to acknowledge Jen Rose Fitzgerald when I have the chance, and all of her amazing hard work putting this entire series together. And the conversations have been really robust and really fruitful. So thanks again, Jen Rose. And then what this springboards into is a set of training development and resource development opportunities, which folks can be keeping an eye out for in early 2022. That aforementioned advisory committee is an incredible group representing, again, St. Louis social sector, national leaders, academics, all coming together with the shared goal and the shared purpose of wanting to advance social sector data practice. So looking forward to all of the things still to come in this regard. With that, I am going to hand things over to Jen Rose, who's going to talk a little bit about today's event and introduce our special guests. Thanks so much.
Thanks, Dan. My name is Jen Rose Fitzgerald. I'm a program coordinator at the Social Policy Institute, and I have had the pleasure of coordinating all of the activities of the Data Science for Social Impact initiative. We're really excited to welcome two amazing presenters today who will guide us through this roundtable discussion. But before I introduce them, just a quick overview of what we'll be doing. So the goals of today are to facilitate dialogue about data governance by centering these two critical questions of who benefits and who decides. Very important questions that often don't get asked when we think about data governance. And to hear how social sector organizations are grappling with this question, and just to gather some feedback about what kind of tools and resources would help us all grapple a little better. So the format of the roundtable, the presenters will share some thoughts and frameworks at the beginning, and then participants will join in a discussion in breakout groups and dive a little bit deeper, and then we will come back together to share some key takeaways. So with that, I think we should jump in. I would like to introduce our presenters for today. First, we have a well-known face and name to folks working with data in the St. Louis region, and an invaluable collaborator for the Data Science for Social Impact initiative, that is Paul Sorenson. Paul founded and leads the collaborative St. Louis Regional Data Alliance, or RDA, at the University of Missouri St. Louis. The RDA supports local governments, nonprofits, funders, and universities in using data for community benefit. And the RDA is also actively involved in building public health data infrastructure to address COVID-19 and other issues, and works closely with United Way 211 and its partners in establishing the St. Louis Community Information Exchange to share referrals across health and social service providers. So that's a mouthful. Paul does a lot. If anyone's worked with Paul, you know he's always very busy. I'm also really excited about our second speaker, who some of you will know as well, Riisa Rawlins-Easley. Riisa is the Chief of Staff at the St. Louis Regional Health Commission, the RHC. The RHC is a collaborative effort. St. Louis City, St. Louis County, State of Missouri, health providers, and community members who are all working to improve the health of uninsured and underinsured citizens in the region. Riisa has served in leadership positions and as an independent consultant for various nonprofits in the region since relocating here in 2004. She has over 20 years of experience in cultural competence and stigma reduction, integration of primary care and behavioral health, and positive youth development, and I very much look forward to hearing her remarks today. So welcome both of you, and we will start with Paul.
Well, thanks everyone for being here. I think, Jen Rose, you need to stop sharing your screen so I can share mine. Perfect. Yeah, and excited to dive in. So as you know, because you registered for the session, what we're going to be talking about today is community-centered data practice. So this idea of data protection, data sharing, who benefits, which are pretty heady topics. And like Jen Rose said, also essential topics that sometimes are not focused on in data sharing spaces in a way that they need to really ensure both an equitable process and an equitable outcome. And so probably this session, maybe even more than some of the other roundtables, could kind of like quickly get into academic terms or concepts or things that are like heady and vague. And so what we wanted to do first was try to provide some like simple definitions of like, what are we talking about when we're talking about things like community-centered data practice and things like governance. And really, to start us off, right, the most fundamental way to think about it is it looks like this, right? It looks like people sitting in a room together, talking and making decisions, or I guess probably in the last 2 years looks a little bit more something like this, which is actually harder to come to decisions around, right? But what we're talking about is decision making, right? And when we're talking about things like governance, Well, what we really want to drill in, right? And then fundamental definitions, right, is like, this is the process of overseeing the control and direction of something, like making decisions about how something proceeds and the resources that are allocated to support it. Very, very important conversation when we talk about data and data governance. Also something that can kind of bring the pieces in the title together around centering community, protecting data, driving data sharing. We were careful not to put data governance in the title of this session, lest like most of you would probably be like, I'm not giving up my Friday morning for that. But really what we're talking about is like, how do we come together to make decisions about all sorts of things, including data policy and data practice. So, Merriam-Webster definition, most fundamental process of overseeing the control or direction of something, that is governance. Of course, we want to get a little bit more specific when we're talking about data governance. So here's a definition in like our thinking of these issues that we like. It comes from a group called Sage Bionetworks. They wrote, I think they called it like a green paper. I don't know. They're nerds thinking about like data and governance and how open data fits together. Worth looking up, right? And this definition is sort of specifically around data governance in a way that's meaningful. So the process of establishing and ensuring the freedoms, constraints, and incentives that determine how two or more parties agree to conduct the ingress, storage, protections, use, egress of data tools, methods, and knowledge, both among themselves and with others. So there's a lot of good specific things to dive into here, right? Like, what does data storage look like? And how the parties come together that are probably what people expect to talk about when they're talking about data governance. Who has the data? Who owns it? How does it go from point A to point B? And who makes the determinations about what that looks like? I think as we think about it a little bit more, and what we're going to encourage you all to do today, start to ask these questions about like, okay, data governance, this seems specific, or it seems like it can help us drill down a little bit. If you like, just start to poke on some stuff. There are a lot of big questions embedded in this definition. So, okay, a process of establishing, but how does the process get established? How are different stakeholders represented in that process? Like good, big questions, right? When we say two or more parties, well, which party? How does one become a party? Who chooses who are parties to the agreement? When we talk about protections, like what needs to be protected? Like who are we protecting? And how is that sort of defined and enforced? Determination, right? Determined by what criteria? How do we evaluate, right? The decisions being made on behalf of our stakeholders and many communities at the table, right? Sharing data with others, that's great. But then what happens when we want to stop sharing data? How do we remove parties? How do you remove parties, right? Like, and these really big questions overarching. So like who has rights? How are those rights asserted in the data governance process? And then harm, right? Like what happens, even when everyone acts as we agreed in these like very detailed data sharing agreements, but something still goes wrong, right? And so what we wanted to do today, right, is sort of frame these questions about data governance that sometimes like tend to get handed off to like lawyers and vendors and like nerds like me who like to look at these things, are really more fundamental around how we come together as a community. So that's sort of the conversation we want to have with you all today. And it doesn't seem like I lost anyone at this point, which is awesome. So the key questions are what needs to be governed sort of above and beyond data. Of course, it implicates data, right? But it can't be sort of looking at a legal agreement where you're asking some of these questions around like, well, whose data are we really protecting? And how do they have a role in deciding what needs to be protected? What systems need to be in place for effective data governance to occur. So this isn't something, right? This isn't a tool. This isn't just an agreement or we selected this vendor and they're HIPAA compliant. We're going to call it a day. What we're really talking about is systems and ongoing systems that need to be in place in order to make sure that effective and equitable data governance can occur, right? And that focus on equity needs to come in both in process and outcome. So of course it's important that we have the right people asking the right questions in the room, right? But if that is still ending up producing an outcome that is inequitable, we should also ask ourselves, okay, is this actually the right table? And how do we make those improvements or changes over time? So very big questions. Ones that we're not going to answer today, but hopefully give a little bit more definition and clarity around how would you start asking them in your context as a practitioner, as a student, or wherever you come from. So quickly, right, like I wanted to sort of say like, well, why am I talking to you about this? Like, where are we coming from? This is a very active governance process in St. Louis that we are a core piece of. So Jen Rose mentioned it a little bit in the introduction. There's an initiative in town called the St. Louis Community Information Exchange. It's being sort of led by United Way 211 as the lead backbone. I represent the Regional Data Alliance as the data backbone. And there's also the Integrated Health Network is serving as the healthcare backbone. And we've been trying, this is a system that is trying to help connect individuals across health and social services. So, making sure that we can address social determinants of health and that there's a way to connect hospital social workers, for instance, with behavioral health services in community-based settings in a way where they're actually able to sort of like make a referral electronically. And then someone at the behavioral health center says like, oh, I got him. Like, we'll talk next week and close the loop. Right. So there are a lot of different people who are implicated in that system. There are the backbones, so the folks who are like meeting probably too many times a week to try to figure out how this system is operating. Their clients and patients, so the beneficiaries of the system. They're social service providers, they're healthcare providers. Their incentives do not always align, right? There are community leaders trying to understand sort of like, well, why, how do we allocate more funding or direct policy toward social service delivery. There are technology platforms, right? There's the Unite Us platform that is being used to make referrals. But there are also all of the technology platforms that healthcare and social service providers use. And of course, there are funders. People who are saying, this is a great idea, we're going to give some money to it. And we also want to know like where our investment is going. So can you report back on X, Y, and Z, right? So like, this is something that I think many of us, maybe not in the same domain, maybe not quite as complicated with as many acronyms, are trying to figure out, right? Like, how do folks come together to have, make data governance decisions, but really this is about governance as a whole. And for those of you who are like for some reason want to know more about this, I'm going to drop a link in the chat to like a 30-page white paper on what we call the tackling data dilemmas in social care coordination. It's a white paper that we recently released alongside a national organization called Open Referral, really trying to think about how these like data components in community information exchanges, so efforts like the one I just described, come together and really spent a lot of time thinking about data governance and community data governance as what needs to undergird these other systems of data exchange. So in the chat for like the two of you who are interested, but really trying to think about like what the impact is on this sort of decision-making in communities. So to sum this all up, right, and trying to figure out ways without like red line definitions or 30-page papers to get you all thinking about how does this show up for me in my work with the communities that we work with. So when we're thinking about governance, I think the two big questions to think about is who benefits from the systems being set up. And who makes decisions? So who decides? Who decides who's at the decision-making table? Who decides who benefits? Who decides who profits or who is funding different initiatives? All sorts of really important decisions are sort of made surrounding these two questions: who benefits and who decides. We would also encourage you to think about those two questions as they relate to different audiences. And we understand these things can overlap. None of this is like very discrete, like we can put it into a grid work. But trying to think about, right? So who benefits, who decides, and how a system has an impact on individuals. So the people who are intended beneficiaries of a service or a system, its impact on providers. So the people who are providing services, providing programs, professionals or professional adjacent folks in these spaces who are providing services and have other sort of like funding contexts, et cetera, as well as the impact on communities as a whole. So one thing that, we touch on a little bit in the paper and have been thinking a lot about is, and there are decisions to be made on like what aggregate data is collected and shared, and how that aggregate data may impact resource allocation and policymaking in a way that needs to be sort of on the table for a lot of folks to grapple with. And so that ends my remarks for the morning, trying to set up this place of thinking about community-centered governance and how it really needs to guide our discussions of where and how data shows up. And to describe a little bit more about what this looks like in real life, and really focusing more on the things that happen before data governance is even possible, I would love to hand the mic to my friend Riisa, who will describe a little bit of what this looks like in the RHC's context.
Yes, thank you, Paul. I'm really excited about this conversation, and I will hold myself accountable to not fast forwarding to the punchline because we need a little bit of a setup. So my privilege is to put some handlebars on all of these ideas that Paul was just sharing about community-centered governance. And while this conversation in this room is specific to data, as Paul mentioned, there are some steps to get there, right? And there are some general practices around governance that will help us to do better, right? And to be better as we're engaging around data. And so I am going to use this lens and this framework around who benefits, who decides. So I want you to keep that in the back of your mind as I share a little bit of our experience, current experience with the St. Louis Regional Health Commission. So I'll start with a little background for those of you in the room who may not have heard of the St. Louis Regional Health Commission. We are a network of individuals formed in 2001. It's a collaborative effort with the St. Louis City and County. That's how we are defining in our initial phase what our region scope is. It's the state of Missouri. There's health providers, community members to improve the health of uninsured and underinsured citizens in St. Louis City and County. So we call that the safety net population. When we say that, we're talking about folks who don't have insurance, who may be on Medicaid, who may be on currently Gateway to Better Health, which is transitioning due to Medicaid expansion. There are appointed commissioners. So the governor's office, the county executive, the mayor all have appointments. We have legislative representatives. There are also 3 peer elected advisory boards that comprise the St. Louis Regional Health Commission. And those are comprised of the Provider Services Advisory Board. So those are individuals who actually are providing healthcare services throughout the region, both primary care and behavioral health. They are frontline staff, they're doctors, they're nurses, they're behavioral health practitioners. The Community Advisory Board, which has existed since the inception of the RHC, consists of, we talked about those social determinants of health. So partners working in the social services sector. A lot of the board is comprised of CEOs and leaders of those organizations. And we also have a lot of boots on the ground, frontline staff who are working in those spaces and understand how the social determinants of health intersect to influence the health access and outcomes of the individuals in the safety net within our region. Our third board, which is our newest board, and I'm a little biased, I'm most excited about it because it's really shifting the conversation, is our patient advisory board. So on this board, we have individuals who are currently uninsured or underinsured, who are navigating the system. So sharing their expertise on what it's like in real time to actually try to figure out how to get access to the care that they need to help inform our strategy and priorities. So that was the inception and how the Regional Health Commission came to be, with the exception, of course, of our newest edition of our patient advisory board. So I wanted you to just to show you this to set the stage for where we are now. So on our next slide, you'll see that we are in a stage of transition. So our 20th anniversary, I said we formed in 2001, hey, it's 21. A lot of things have happened since then. There has been a shift where the Regional Health Commission, a lot of our work over the past 11 years has been after the passage of the Affordable Care Act, providing a mechanism for folks who would otherwise not have coverage, a coverage model for access to healthcare. We worked hard on Medicaid expansion. Kudos to those who were a part of that work because it was all hands on deck. And so now we're able to do the work of transitioning folks from gateway to Medicaid expansion. Well, that significantly shifts what our work is. And so when we think about the questions of, okay, who benefits, who decides, what is the work? It was important for us to consider all of the stakeholders around the table and how we call the question about what the work should be and who leads it and how we're listening to and being informed by the perspective, expertise, and experience of those who are seated around the table. So we developed a transition task force, and that's the work that I'm going to use to provide some handlebars and some tactics to how governance looks in real time and some of the things that you may have to grapple with as you try to engage this in your own areas. So we got a team together, we got a charge together to think about, okay, what is the opportunity? Where are we now? What do we want to come out of this process as we're transitioning the work of the Regional Health Commission? Who is going to be engaged in the conversation? So on the next slide, you'll see the representation. We were very specific about who needed to be around the table. We knew that there needed to be a policy and advocacy component. We've done a lot more work around policy and advocacy and informing what we prioritize in thinking about, because of course, equity is the foundational lens of the work that we're doing, thinking about how policy implications have reinforced and influenced inequitable outcomes in healthcare, with access and outcomes, right? And so what are the policy interventions that we should consider as a region and work together towards collectively in order to transform the environments that created and perpetuate those inequities? So having that voice was really valuable. Having community advocates on the table. We knew from the inception that it was absolutely important for us to think about those who are on the front lines of providing care, both traditional and non-traditional care, right? So not just as you think about like doctors and nurses, but we're the community health workers and the peer support specialists who are actually working real time with individuals. Who are the individuals who themselves are saying, well, no, I can tell you about that system because I tried to access it yesterday and let me tell you what the barriers were. Who can give us those real-time point of service failures, right, that we need to consider within our healthcare system? Of course, we need our board members because we need that authorization, partner organizations, because none of this can be done in isolation. We can't do this solo. So, you know, the saying, many hands make light work. So how do we join together and understand what our skills, talents, resources, and networks are to leverage them in ways that allow us to improve access and outcomes for the safety net population? And our public health departments, because undergirding all of this is public health. So I take some time to talk about the stakeholder representation because I want us to continue to think about, again, benefit and impact. And who are all of those stakeholder groupings that should be considered when we're thinking about governance, when we're thinking about what the work is, how we approach it, who we engage, and our accountability to how we're moving forward and measuring our progress and success in that work. The opportunity statement that we came up with and that we shared at the beginning of every transition team statement is here before you. As a St. Louis Regional Health Commission transitioning operations to understand the underinsured and uninsured landscape in the context of Medicaid expansion. Again, that was the opportunity. Things were changing. So how can we understand what the changing landscape was with the lens of all of our stakeholders to create the plan, the strategy, the work that would lead us into the next phase of what we're calling affectionately RHC 2.0. I don't think that'll stick, but that's what we're going with for now. Okay, so now I'm gonna dive into a little bit more of, in the next slide, we'll talk about a little bit more of what that now looks like. I'm super excited because just Wednesday, it was just this week, y'all, it was just this week. We got our new theory of change approved, and we have an action plan that's approved. We have a new logo, but y'all don't have to wait on that for the big reveal, but that we're moving forward because of these conversations. When I was having this conversation with Paul, and we were thinking about what we wanted to share and how we wanted to frame our discussion for the breakouts, one of the things that continues to be most powerful for me, like, this is super simple, like the theory of change, the whole document, all that, it's really simple. And it looks like, okay, yeah, no, you got a theory of change, right? But the conversations and the work that went into it, and the tension and the grappling with really trying to lean into how we share power and how we create space for bi-directional communication that allows us to engage perspectives outside of our own. That's the secret sauce. Like, that's the work. That's the beauty, and that is the challenge. And so at the end of this process, we thought about who are all of the folks who are important to engage. And I'm showing you this because in the very beginning, I showed a circle, right? And there were arrows pointing out to all the other circles, and that was RHC 1.0. And so in RHC 2.0, we thought a little bit differently about who's not at the table, right? So that's something that Paul brought up in his remarks earlier, about thinking about who haven't we engaged that's important to engage. So all of these folks around the table in some way or another influence our ability to get to our mission and our vision of zero health disparities. And so how do we engage each of these folks in ways that are meaningful and significant? So the next slide will share our revised, well, I don't think we had a vision statement before. So our new vision statement and our revised mission statement. So we decide, go big or go home, right? So we're talking about zero health disparities and community-driven approach that yields health policy in all outcomes, right? These are weighty things. We received pushback on, okay, well, can we really be accountable for it? But what's a vision if it's not going to inspire and motivate you and compel you to move forward? Some of the conversations that we even fielded during this process was the tension between some systems leaders feeling, okay, so I'm going to be implicated in this, and what is that accountability, and what does that mean and look like? So that a little bit of anxiety around what that would mean and how it would change and reform our work. And then that tension of community members who were even saying, this isn't strong enough, we need abolitionist language. We were like, whoa, right? So how do we find that sweet spot in the in-between where we can feel like we can all feel like we own this work, and that we were seen and heard in this work, and that it will then inform what data we collect, how we share that information, what are the metrics that we're looking at. And so we decided that this is where we wanted to lean in as we were looking at the landscape and trying to understand where the need existed and how we were able to help advance the work that some of our strategic partners are doing around the region. So serving as a regional model for bi-directional relationship building, shared decision-making, harnessing the power of systems and communities. For what? Like, to what end? Accountability, to improve equitable health access and outcomes. And we named it, particularly for communities of color. So using the framework of targeted universalism, where we can all agree on what some of the greatest needs are within our community. The data tells us where the needs are. But if we are thoughtful and intentional about our data and what we're trying to encourage folks to do, and disaggregating our data in meaningful ways, we don't just know what the overarching picture is, but we can also understand where the need is greatest. and what communities are bearing a disproportionate impact of the issues that we are trying to address. So using this model and serving as, or this framework, and serving as a model of how to grapple with and fail forward in using this approach, this is what we're deciding to lean into for the next 20 years and beyond of the St. Louis Regional Health Commission. So this is our theory of change that we are really proud that was just approved, hot off the presses. So y'all are some of the first people to see it. And what are the transformational impacts that we're looking at? One of the reasons why I'm so proud of this is because I shared with you before each of the stakeholder groupings that was around the table for these conversations. So, imagine, if you will, a room like the second room that Paul showed. It was on screens. We were in the Zoom room of the leaders of some of the largest healthcare systems in the region. Well, BJC is actually bigger than just the region because they're multi-state, right? And community members who are actively navigating health systems with no small degree of frustration, having conversations around what is the impact that we need to see, and how do we know that we're actually making progress, and how can this be something that feels meaningful and significant and important within my context? How can I see myself in this work? How can I see value in this work? No, that's fine. You can go ahead to the next one. So that's what led us to our transformational impact. That's what led us to the how, like what's important, how are we going to do this? So the championing of solutions, the translation of information. One of the things that we spent a lot of time grappling with, and one of the biggest changes we'll probably see in our work, is our relationship with and to data. So understanding data as a resource, understanding data as a tool, ensuring that the data that we collect and what we communicate is accessible and actionable across all of our stakeholder groups. So whether it is our patient advisory board, can I look at this data and understand what that means and why I care? Beyond that, what do I do about it? Is there a clear pathway for me to then take action on the things that are important to me? We have found that our providers, they use it all the time. Like, this has been meaningful data to help inform strategies and priorities, workforce development and things of that nature. But how can we ensure that we're speaking to each of our stakeholder groups in a way that is meaningful, equitable, and actionable? And so what we're leaning into now in our action plan for the year ahead, at least, is centering regional coordination and communication. In each of our buckets, I call them buckets because, I don't know, I like buckets. But it's always to what end? It's never just the thing, but why? Like, why are we doing this? Why is this important? And that was really important for us to consider and grapple with across all of our tables. So to execute equity-centered agenda for health and well-being. Again, naming it and ensuring that we are, in naming it, creating measures that hold us accountable to efforts to outcome. Like, how is what we're doing moving us closer? That shared data reporting is huge. I rest on that for a bit because I worked for RHC back in 2005-07, back in the earlier iterations of the Regional Health Commission. And one of the things that we were looking at on a regional level was creating a network master patient index. And I still have some residual trauma from the NMPI conversations that we had, because when you start talking about data sharing, like, people's hair catches on fire. Like, it's the whole situation, y'all know, right? And so we got bogged down in the conversation about HIPAA, right? And we never got to the conversations around meaningful use. So we thought about what we couldn't do and all of the barriers that existed, and as try as we might, and as many course corrections, we never got there. I think the orientation of the conversation today and in this space is an opportunity for us to think differently about data, for us to think differently about data for meaningful use and role-based access. And so that governance piece becomes everything. Because I sit and I think in some latter work that I did with the St. Louis Regional Systems of Care, hearing young people, when we were asking them about what their pain points were in navigating the systems, one of the things that they explicitly mentioned to a person was around sharing their data. Like, it is traumatizing for me to have to tell my same traumatic story to multiple people when I feel like where is this information going? And why am I continuing to share it? So just causing us to think differently about data and what does it mean? And what is the relationship and the harm that we can actually inadvertently cause because of how we approach and think about data. So again, using that to measure efforts to zero health disparities. We don't get to accountability if we're not sharing that information. So community-driven policy change is also really important to us, again, always for the purpose of health, equity, and well-being. And then increase workforce wellness and capacity, because we can't do this without a strong, thriving workforce that exists to address the needs, not just today, but to be able to anticipate and plan for it. So that's the value and the beauty of data. One of the things that we often talk about, and one of the reasons why we're leaning so heavily on this data piece of the conversation, is that as you can see, it informs every other piece of the work. We can't do any of this, right, without having strong data. And that lends itself, again, to where we started the conversation. Like, who benefits, right? Who decides? So again, it requires us to be bold and to take risks, to include non-traditional voices around the conversation, so that we're ensuring that individuals, providers, and communities who are in some way going to be implicated or impacted by this data have an opportunity to inform what it is, how it's collected, and have an opportunity then to inform what we're pulling out of it so that we can see benefits. So again, we want our stakeholders to see themselves in the data. We want them to understand what they're reading. We want them to understand why it's important, why they care, and what to do about it. So that's the framing of the conversation. And hopefully that example helps to percolate some ideas in your mind about some of the work that you're specifically doing and how you might broaden that conversation to think about who's missing, right? And how we might change some of those governance questions broadly to inform our data questions, which then feeds back into the entire process. Talk about that closed loop. All right. So that's all I have.
Yeah, awesome. Thank you so much, Riisa, for that. And I think a really, really good example of how we can intentionally center community in these governance conversations, which absolutely have an impact on data, but sort of recognizes the role data plays within a broader community and policy environment. I also want to say that, like, most governance conversations do not look like what Riisa described, which is like a very intentional point of transition, multi-stakeholder in the same room really grappling. But it doesn't mean that governance doesn't exist and that these decisions aren't made. And actually that is something that is worth like poking on as well across multiple, arenas and data practices. So I don't know, Jen Rose, before we break into our breakouts, maybe we'll pause for a second to see if folks have, based on, the half an hour of stuff that was just presented, any clarifying questions, about where this shows up before we ask you to sort of apply it to your own work.
Sure, if anyone wants to jump in with a question, either in the chat or come off mute, feel free to do so. But the breakouts really will be a space where you can come and ask those questions, and or also listen and learn if you're still thinking. I appreciate the use of the word grappling a lot, because this is a grappling. There's not a real simple playbook for how to do this stuff. You might have a really pretty theory of change, but how do we know how much time to take to grapple? That's a great question.
You don't. That's part of the grappling, right? And so I'm really glad you asked that, because what I failed to mention, we had a timeline, y'all. We had a nice little cute little timeline that would be, completely aligned with our anniversary. That's not what happened. And I was speaking to Paul yesterday, and I was referencing like a specific conversation where we came into the room and we thought we had listened really well to all of the things we had heard. And we put things down on paper and we were presenting it to the group so that we could approve this and go like it was the next phase of moving forward in our plan. We missed it. We missed it. We didn't get it. And so when we were having the conversation, it came to a screeching halt because folks were like, that's not it. Like, I'm not energized by that. I don't see myself in this. I don't feel like you really got what we were trying to say. So we grappled some more. And what eventually happened past our what we thought our arbitrary deadline was, what eventually happened was we got feedback that said, this is it. Now, of course, it's not the end all be all. We're still moving forward. Like there's still more that we need to do and that we still need to continue to grow and evolve. But to have both system leaders and community leaders independently reach out to say, I feel heard, like I feel like we really captured it. That is the value of the grapple. So I can't give you like an arbitrary timeline. It really has to be dynamic and specific to the work you're doing and the folks who are in the room where it happens. I told y'all there's a Hamilton reference.
The one thing I'd say, and Riisa, I'm curious about your thoughts here too, is that it seems to be, right, I think you're spot on in terms of it's not like, please do not take more than 12 weeks to grapple, or, like this is not, baking, right? Like with like very set measurements and timelines. I do, the one thing I would say is that if you get the sense that like, you're continuing to grapple because it's like hard to make decisions and move forward with things. Like I also like, there'll be a point in which you'll see, all right, we also need to take action because then people can grapple with the actions that are being taken. And that also is sort of like a productive feedback loop in and of itself. It's just sort of like the only other kind of guardrail on the other end. There are some awesome questions coming in. So maybe what I'll say is Riisa, do you want to like pick one or two that you want to address and then we'll go into breakouts and continue to grapple, for lack of a better term?
Right. I do want to just also piggyback and say that the grappling is this process and outcomes. So sometimes it's not the thing that you're grappling with, it's the how you're doing the thing, and it's the wrong process. And so don't be afraid to say, oh, we thought that this was the right way to do this, but this is not working and we're hitting roadblocks. Let's course correct and try a different strategy or approach. So the grapple comes in many different ways. Project include processes for safety net system. Healthcare is important. Ensure you're creating a system of long-term or intermittent dependency on it. One of the things that we're thinking about is long-term. How do people create relationships? So we see ourselves as a broker for long-term, trusted and sustainable relationships, right? We are not prescriptive about where you should go, but we want people to have places where they feel like they're valued and seen and they can get the care that they deserve. So one of the things that we understand is that access, one of the things that bankrupt families the quickest, one of the biggest debt we have is healthcare debt. So ensuring that there is a pathway for folks to at least have that access is important. This is where it becomes important, you talk about dependence, to partner with other organizations who are working on social determinants of health, because that is a part of the strategy if you think about building generational wealth and how you lift folks out of poverty. And what does that look like and what does that mean? So we understand this isn't something that we can do alone or as an organization, but it's about how do we convene to understand the broader pictures and the intersectionality of the issues and where we are best positioned to move those things forward. The data, the silos, they're all around our table. So one of the things that we do is annually we produce, well, it hasn't been because COVID, we produce an access to care data report. And that report includes information from our federally qualified health centers, our hospital partners, to show how we're doing as far as access is concerned. We also have relationships with some state level providers. And so we're thinking about, is that something we need to leverage a little bit differently? We've been fortunate thus far because our partners have given us, they give us their data in order to report it. And so we're thinking about what does that mean to the workflow of the partners that we engage, and how can we make sure that we're good stewards of those relationships and that information, and that we're doing it in the most efficient and effective way. So we continue to grapple with data silos by having all the people at the table so that we can actually surface the uncomfortable conversations and figure out how we address it. It's hard. It's sometimes uncomfortable, but that's how we roll.
And I think it's also trying to understand like why the silos exist,
Yeah.
like, because it's not for, I mean, it's not necessarily for a good reason, but it's often for a reason, right? And what do we really need to do, right, to build trust and relationships to make it easier to break those silos, which is why the why is important, right? Why these larger tables that determine things like what does the, you know, data agenda look like beyond just like, oh yeah, let's share data are so important, even in making some of those data sharing activities happen. So I'm looking at the time. I know that we didn't get to every question here. Carry them with you into the breakouts, or, you know, carry them with you into your work. But would love to now, yeah, Jen Rose, tell us what we're doing.
People will be automatically assigned to breakouts, and please join the breakouts in whatever way you can. I know some people may have to be on screen or off screen or want to listen or really excited to share, but please do join the breakouts. You'll be automatically assigned, and you can continue this conversation with Riisa and or Paul and or Talise, and we look forward to seeing you in there.
Okay, welcome back everyone into the main space. We're going to have Jen Rose take us through just a little bit of wrap-up discussion. I'm on the edge of my chair to hear how the discussions went across the rooms. And thanks for sticking around. So Jen Rose, why don't you jump right in?
Yeah. Hi everybody, welcome back. I was in one of the rooms for a little while, and it was a really great conversation. We'd just love to hear a little bit about what you all talked about. So first, I want to thank our breakout facilitators, including Paul and Riisa, and also Talise Masawi and Tyler Frank, two of our esteemed colleagues who agreed to facilitate today. And we just love to hear some takeaways from your conversation. So especially interested in this disconnect between who is impacted and who is deciding. It was definitely a main point in our group. But if there are other things you would like to share, of course, that's fair game as well. I'm just going to step back and invite facilitators or participants to come off mute and share.
The classic game of Zoom chicken.
Okay, I'll go. It's Jennifer Adams. Hey, so a lot of things that we talked about were that I think from the very beginning, the problems are not vetted, like they're not being asked by the right people. So the whole effort isn't necessarily even addressing what the problems are a lot of times. And then I think also to make sure that the right tools are being utilized to not just be so broad of a measurement, because that can be misleading and misguiding too, in terms of what are we measuring? Is it too broad? Is it too general? And then also, I think making sure that the assessment phase, they're asking the right questions, the way that they're framed is really important. And I think also collectively, you know, throughout, I brought something in, you know, the nation is, you know, having regional, you know, kind of groups that are comparing, you know, the information and to be able to hold and help these you know, municipalities and regional governments be able to do a better job because they can't do it with the resources that they have.
Thank you so much for that. That's a great point. That's a great point.
I think one of the things that came up for us in that conversation was how predominant funders are at decision-making tables, and that can be philanthropic or like state or federal government. And in some ways, like there's not a decision-making table. Like those funders seem to have like oftentimes either sole discretion or could have sole discretion on how funding is allocated, and thus on like program impacts and priorities, and just kind of the complication of that, you know, where you have sort of these unitary bodies kind of making decisions on program priorities and funding allocation. And maybe they have an advisory board, but it doesn't look like, I think the RHC model or, other models we think that are broad and bring, diverse voices to the decision-making table. I just wanted to kind of raise that as a point of grappling that we had, that I'm also wondering if it came up in other conversations too.
Hi, this is Hannah. And it actually came up in our discussion in a slightly different way. We were talking about feedback in communication when people are sending out messages and then integrating feedback after, someone hears a message, and the kind of disconnect there, and how funders aren't in the room for that process. Oftentimes, they don't get to see the behind the room or behind the curtain deliberation about what will the final message look like, how will it be tweaked, and therefore funding it hasn't been directed towards kind of the integration of feedback. It's more towards putting out a message.
So I kind of want to add a little bit to Hannah's point, because this came up in our group and we talked about, like this, that disconnect, not just like at the funder level, but like the intermediate, like if we're talking about interventions. So there's like the group receiving the intervention, or, the family receiving the intervention. There's the funder over here, but the intermediate being the people who are delivering the intervention. And so like, even just thinking about how do we involve those people? How do we bring them into the conversation? Because they are the people on the ground doing the work. And somehow, it's just, I'm just thinking about, if an interventionist comes and they're reporting that, hey, this thing that you want us to do isn't really working with this family because they're facing A, B, C, D. Like if we are not involving them, and if we are not willing to listen, or, in some interventions, if we then decide to blame them, well, you're not doing it correctly. That's why it's not working. I told you to do it this way. But, the interventionist is telling you like, well, yes, you set this thing up for this ideal situation. This community or this family or, this group is not in this ideal situation. And then, how do we then integrate that feedback into what we are trying to do? So I think like that is one area where there's such a big disconnect, even just outside of the funding or, the community or family or population.
Other thoughts from the breakouts? I know I'm not sure who's in what groups, but I think these are all great points that, Jennifer added in the chat. Too often funders, businesses, and elected officials are taking guidance from the wrong individuals or groups or experts. That's also a great point.
I'm curious about whether folks, how folks were grappling with how these governance conversations, which are, sticky and are like sometimes hard to put your finger on, but like specifically how they show up in data sharing spaces, and whether folks have, what I think about when I think about data governance is like a data sharing agreement, right? And when you're trying to define, I will share my data with you for this purpose, right? But that, in my experience, oftentimes that is being done in a vacuum and not in reference to these broader decision-making kind of governing structures. So I'm curious if other folks have encountered that sort of disconnect between like, well, this is a data decision at the moment, but it really should have been a broader community data, like a community governance conversation.
Yes, this is Jennifer. I have, and I've seen it often, and a lot of times too, they'll ask many people to get data, and then they don't want to use the one that doesn't bode well for them, right?
I also want to add, like, sometimes like even just thinking of like what is the data we're collecting and why. So like coming from like the researcher perspective, we just like collecting things. Like we want to know everything. We have a study where the thing we're interested is very simple, but we're like, well, while we have them, let's add these other 6 measures. And then it's like, why? Like, I mean, really, why? And then, it's just like, well, we might want to use it at some point. And so, in the research space, you end up being in a space where people are like, well, when we did that study in 2014, we collected that data. Nobody ever wrote a paper about it. We should do that now. And you're like, well, it's 2021 and the world is different. So but then, beyond just the collecting data uselessly, it's like, if we are thinking about the communities, the families, the people that we're working with and asking these things of them, why are we asking these things, right? Like if we are collecting social determinants of health data and a family tells us, they're facing food insecurity. Okay, and then what? It's pointless to ask that question if we are not going to provide a resource or a solution. And, kind of going back to what Riisa was talking about earlier, about how do we really think about how the questions that we ask re-traumatize people? And are we being, good stewards of the data we are getting, good researchers, good funders, good whatever, and how, for us, data is really that point at which we need to think about those conversations and, the decisions we're making, and really think about, why am I asking this question? What am I going to do with this information? If something comes up that I cannot resolve, what is my next step? Not just leave communities, families, individuals just floundering, like, okay, now I told you I can't eat. And then you are like, thank you, goodbye.
Yes, thank you so much for raising that. And it resonates so deeply, as I saw a number of the folks who are on video nodding and along, particularly around the needing to ask lots of different questions for lots of different purposes and never actually really being sure why. And one reflection that's come up in some of the other spaces, both virtual and otherwise, that I've gotten to participate in recently that I'd offer is, kind of an unintended or unanticipated consequence of a lot of the push for collaborative research and transdisciplinary research can then lead to mission creep research and needing to factor in just quite a lot of things into every single survey, every single focus group, every single interview, which tends to not be driven by methods or being community-centered, tying back into the themes of today, as much as the kitchen sink approach. So it really, really resonates. Thank you for raising that. And to Jennifer, Talise, Hannah, other folks who are chiming in on the chat as well. So with an eye on the clock, this is my chance to say, don't touch that dial, which I guess is outdated now since we're all watching Netflix and there is no dial. But before folks take off, we had one humble request. So we're dropping in the we're dropping in. Jen Rose, thank you so much for dropping in the chat a link 5 minutes or less while you're even here as we're wrapping up to do a very short survey. Speaking of how many questions get asked, we poured over this one and we shortened it as much as possible to try to get people's honest feedback about these roundtable series, and then also looking forward to how we can kind of structure program design more robust and sometimes even longer training opportunities. You're here, you're participating, so you are the target audience for folks who are really interested in reaching and continuing to support. So in addition to the survey, we always like to leave with just things you can do coming out of the space. So of course, we've got the 5-minute survey. We've also really enjoyed hearing from folks after the session concludes, whether that's a reflection or a reaction, something that you continue to be thinking about, a resource that comes across your inbox that you think would be beneficial for us to know about, or even if you're working with an organization, an opportunity or a barrier that you're working through in real time. This feedback is so important and critical for us in terms of thinking about what's going to be most timely and relevant for folks in terms of the training and resources that we're able to provide. Speaking of your organizations and your affiliations and your consortiums and collaborations and coalitions, we'd love for you to bring these conversations back. We know that data, when we schedule a meeting and data is in the subject line, it might not be the most exciting for everybody, but as Jen Rose has written on the Social Policy Institute blog, we like to imagine that everyone is a data person. And so helping to foster that and build that community, both across our organizations as well as within. And then last but certainly not least, as I look at Paul Sorenson's rectangle, and the link is in the chat as well, to please do, if you're not already, become a member of the St. Louis Regional Data Alliance. It's an incredible group, both with large format meetings, as well as some really innovative opportunities for folks to be connected to data practice here in St. Louis. So with that, it's my pleasure just to again say thank you. We are at exactly at 11:29, soon to be 11:30, so it's a new record. And so we'll hang back for just another minute or two if anyone has any immediate questions, and look forward to seeing people in the not too distant future. Thanks again.
Yes, thank you so much, Paul and Riisa.